warahmatullahi wabarakatuh. My name is Reyanah. Here I will read the text of the work of the village medicine man. Medicine men and modern doctors. In most urban and suburban areas throughout the world, sick people are taken to a doctor's office or to a hospital for treatment. But among tribal and village people in many countries, patients are taken instead to a local medicine man. This medicine man is a combination of a doctor, priest, and psychologist. Some of his folk methods are similar to those of an urban doctor, but most are very much different. The difference in method is a result of the fact that disease, to the modern, scientific mind, is viewed as something natural. It is caused by virus, bacteria, and other small things that we can't see without a microscope. By contrast, in much of the world, disease is considered to be something supernatural. In other words, sickness is not caused by something psychical, but instead is the result of deep anger, broken religious laws, the hatred of enemies, and so on. And urban physicians know how to treat a specific disease. A medicine man, however, treats the whole person and often the patient family and friends as well. Prevention of disease. Of course, there may be no need for treatment if people know how to take care of themselves to prevent sickness. A modern physician might tell his patient what to eat, how much to exercise, when, and how to relax, and the like. A medicine man, on the other hand, tells his patients to wear a mullet special necklace for protection against and spirit. Nevertheless, in both village and urban societies, people do become ill and sometimes need medical help. The diagnosis. The first step in any treatment, of course, is the diagnosis. The doctor or the medicine man has to find out why the patient is ill and decide what to do about it. For the diagnosis, but as about symptoms. Is the patient complaining about headache, stomach ache, insomnia, skin rash? But the similarity in methods ends there. The doctor's next step is to give blood tests, take X-ray, etc. While the medicine man involves supernatural methods, he might ask the patient about his dreams, use astrology to find the cause of the problem in the stars, or go into a trance, a condition of deep concentration in which he doesn't function normally. In an effort to contact spirits or other beings outside the world. The cure. After the diagnosis comes the cure. In modern medicine, the solution usually means one or more of the following. The same methods that are used for prevention, helpful food, rest, exercise, perhaps warm baths or massage, drug or surgery. Likewise, folk medicine includes some of the same cures. As in the diagnosis, however, a medicine man also uses a wide variety of different methods in his cures. Two of the most common are exorcism and soul hunts. Exorcism is based on the belief that disease is caused by bad spirit. Thus, in an exorcism ceremony, the medicine man performs a number of traditional activities to take the evil beings out of the victim's body. Song, dances, and religious prayers are part of any exorcism. And soul hunts include them as well. In the ceremonies, the medicine men try to persuade the victim's souls, which are believed to have left their bodies, to return. And next, a typical tribal ceremony. The Ndembu people of Central Africa believe that the illness is often the result of the anger of a relative, friend, or enemy. This emotion, they say, causes a tooth to enter the body of the person who is the target of the anger and to create disease. When the medicine man decides which body part contains the evil tooth, he calls together the victim relatives and friends to watch a ceremony, at the end of which he removes it from the patient through arm, leg, stomach, etc. Although the patient and the villagers know what has happened, that the tooth has been hidden inside the medicine man's mouth the whole time, The patient is often cured. The Nembu ceremony is typical of treatments around the world, in which stones, insects, or small spears are taken out of sick people. Despite scientific evidence that disproves the effectiveness of such method, the fact remains that the treatments are often successful, and many villagers prefer to be cured in this way than by modern physicians. And the success of medicine men. Scientists ask how medicine men can actually be successful in their treatments and why they are so popular. The answer probably lie in a combination of the following reasons. First, supernatural ceremonies are symbolic, and the people who participate in them believe deeply in the symbol. Even Western physicians agree that patients with deep faith believe in God, doctor, the doctors and the drug they take, image or symbols, will regain their health faster than patients with little hope. Second, ceremonies may be effective because people come together for a common goal. Patients see how many people in their communities care about the cure. In addition, these communal meetings provide socially acceptable opportunities for the people of the village to express what they feel. Social and psychological problems can be solved along with the psychical ones of the sick person. Fourth, scientists theorize that the trance part of the ceremonies produce certain chemicals in the body, which then work to help cure the disease. Finally, many of the medicine men's natural drugs, which come from a nearby forest, jungle, or desert, have been found to be medically effective. Scientists are fascinated by what they learn from the methods of tribal medicine men. Summary. This text discusses the difference in treatment between modern doctors and village shamans. Modern doctors usually use scientific methods such as blood tests and X-ray to diagnose the treat illness. Meanwhile, village shamans use supernatural methods such as astrology, spirit contact, and exorcism rites to identify and eliminate the cause of illness. Although the methods are different, village shamans still succeed in cleansing patients with symbolic and strongly believed traditional ritual. Scientific facts have shown that these traditional methods are sometimes effective and popular among the rural population due to social solidarity and strong spiritual beliefs. An example in Islam, rituals and prayers. Village shamans use rituals such as exorcisms that are similar to prayer practice in Islam, where prayers are taught to heal and protect against spiritual harm. In Islam, many worship practices such as prayers and supplications also have a spiritual healing dimension. Example of actual facts: traditional and modern use in healing. The factors that lead to the success of traditional medicine are still not fully understood scientifically but are often effective for local communities. This is in accordance with research that show that many people in rural areas prefer traditional medicine over modern medicine as it is believed to be more powerful and effective and is a cultural heritage that has been used for generations. Example from personal experience. For example, if you have used herbal remedies from your ancestor or village doctor because you did not have access to modern medical facilities, then you will find it easier to understand how the traditional disease management system described in the article works. Example, I remember when I was sick as a child, my mother always gave me herbal medicine that she found in the forest, although it wasn't entirely scientific. The traditional methods worked to make me well. Okay, that's all from me. Wassalamualaikum warahmatullahi wabarakatuh.